Mary Germa. Today I'm going to describe you the nursing field. But for me, nursing is a mission. If someone wants to make a difference in the patient's life, if someone wants to promote appropriate, safe, and affordable healthcare, they can go to study nursing. But the primary duties of the nurse are a lot. Everyday nursing has a typical duty, like nurse have to work. Nurse has to work as a part of a team of a professional and medical staff that include doctors, social workers, and therapists. The typical duty of job nurse include uh, every day they have to assessing and planning nursing care requirement. Nurse has to providing the pre-op and post-op care because they after operation they have to monitoring and administrating medication, administrate sign and symptom and intravenous infusion to make sure every patient after each 15 minutes they have to take pulse, they have to take temperature, and then they have to writing a record about this kind of operation. They have to organize workload. Sometimes they have to provide emotional support to patient and relative. When there is a internship, they have to tutoring student nursing. They have also uh, a nurse has to have a good skill, like they have to have good health and fitness because they work so hard. They work sometimes 16 hours. If there is an emergency, the staff is not correct. They have to do overtime, and they have to caring and compassion. Nursing has to have excellent teamwork and people skills like observational skill, ability to use initiative, ability to deal with emotional charge and pressure situation. Sometimes the patient is very sick, and then for some who has cardiovascular disease, they can have a cardiac arrest, and when it's happened, the nurse can give the first support before calling the doctor. They have to know how to deal with that, and then after they have to have a verbal and writing communication skill. uh, Sometimes also they have a lot of kind, like in the hospital, we can meet a lot of kind of languages like Spanish, French, English, German, Arabic, Creole, a lot of kind of language, patient language. We have to know how to deal with all of them because we have to give care even we don't speak their language. It is very interesting sometimes, but it is embarrassing at the same. If we cannot communicate with this patient, it is very hard and frustrating. But for the place, there is so many places that nurse can work. Like if they can work in the hospital, residential home, prison or jail. They can work also in the agency. There is a lot of health center nowadays. They can work at school, company, etc. But for me, nursing is a mission. If someone want again to make a difference in their life, they can go there because it is very interesting, but it is a hard work also. Thank you.